We've all dealt with that nagging cough, but when do you need to get it checked out by a doctor? Well, right now we have Dawn from Osceola, Arkansas on the phone with us. Welcome to the show, Dawn.
Thank you.
So, what's going on down there in Arkansas?
Okay, both of my boys are constantly getting croup. So are some children just more susceptible to croup than others?
Oh,
and
wow.
also, will they ever grow out of it?
Oh, yeah, good question, Don. Now, I'm curious, how old are your boys?
One is 7 and one is 21 months.
Well, we have a video of actually another baby with the croup, but I want to see if it sounds like your kid. So go ahead and play that. So it kind of sounds like that barky kind of sound.
Yes, that's exactly what it sounds like.
All right. Well, for those of you at home, croup is basically caused by a virus, and usually the virus is called para-influenza virus. It's not the flu, but it kind of sounds like it. And basically, it causes a swelling in the upper airway near the voice box of a child. And what happens is the airway swells and gets a lot narrower, and it kind of looks like this. I'm going to show you. This is like the width of a normal airway, but with croup, it narrows and gets a lot harder for the air to pass through there. And when the child is excited, crying, coughing, scared, it can get really, really loud, and it can get pretty scary. Now with croup, oftentimes it starts as a cold. You may have a cold symptoms for a couple of days, and then usually at night, maybe the second or third night, the croup symptoms come on. In the middle of the night, your child wakes up barking. And so what you want to do immediately is turn on the hot, steamy shower in the bathroom, because that moist air often helps the airways relax. You also want to keep the baby calm. If they're nursing, go in there and try to nurse, keep them calm. Don't try to mess with them too much. Just kind of rock them and try to keep them calm, because a calmer baby will have an easier time breathing. Some of the typical things you might do for a cold, like the antihistamines, can actually make croup worse because they dry out the airway. So you want to talk to your doctor about which ones are going to be okay to use. You want to stay nice and hydrated with either electrolyte solution or water, depending on what your child needs. And one thing, we know croup gets worse at night. So if they're starting the croup symptoms during the day, you can pretty much guarantee you're going to be having a hard time at night. So you definitely want to call the doctor, maybe go in, get those steroids on board. It'll save you a trip to the ER.
Yeah, and you bring up a great point. And Don, this is something where if you're not sure and your child is starting to look worse and you see them having respiratory difficulty, you get checked out sooner rather than later,
Also,
right?
other bad signs, if their color isn't right, they're getting bluish. If their airway is so tight, they're drooling because they can't swallow. Those are bad signs. If they're really having a hard time breathing, another bad sign. Also, I mentioned the steroids. I get a lot of calls from the ER because the parent, maybe the ER physician is wanting to prescribe steroids for the baby, and the parents are thinking, wait, steroids? I don't want to give my child steroids. In croup, it's usually just a couple of days. There's really zero side effects I ever worry about when it's just a couple of days, so go with the steroids if the doctor's recommending it.
Yeah, usually croup is treated with one dose of steroids, and that's it.
Yep.
No more after that. The one thing you may have mentioned this, as far as the age that you grow out of croup.
Yeah, maybe 5 or 6, the airway starts to be naturally bigger anyways, and you won't get the croup per se. You'll get more of a laryngitis. So I would imagine your 7-year-old is kind of out of the woods in terms of going to the ER for the croup. They'll probably just have a barky cough that's not too bad.
Right.
And Don, one really important thing for you, anyone at home, is the parainfluenza virus. It affects us as adults too. We'll just have a cold.
Yeah, or laryngitis.
Or laryngitis, but we won't get that sick. That's why it's so important if you as a parent, you're sick, to do the simple things, good hygiene, washing your hands, because obviously if we pass that virus on to our children or vice versa, pass it from one to the next. Exactly. Well, Don, best of luck to you.
Thank you so much.